warmly welcome Professor Chow and Dr. Leung to our class, Law, Ethics and Aging. It's a great honor to have these two experts on disability and law joining us for our course, because these are really, they are leading experts in Hong Kong on on disability law, and I'm sure in Asia as well. There's still not many scholars who are working in this area, but it is very much a fast growing area, an emerging area of interest from obviously not just a scholarly perspective, but also a policy and practitioner perspective. Just like law and aging, law and disability is a really growing field in Hong Kong, China, and Asia generally. It is one that's probably received more attention in Europe and US, but this is changing, and I think there's a global movement over the last 20 years because there's an international convention on the rights of people with disabilities. So a really warm welcome to Professor Chow, who is the principal investigator of this particular project on accommodating the needs of persons with disabilities in policies concerning public health emergencies, looking at the law, ethics and practice of this field. So he's Professor Chow is at the City University of Hong Kong and a core member of the Public Law and Human Rights Forum. And Dr. Leung is postdoctoral fellow, also at the City University of Hong Kong. And they've, as you know from the reading materials, they published this really important report that is supported by various organizations in Hong Kong and funded by the government to look at this very important area. They've been on a bit of a rock star tour in terms of giving a lot of public seminars on this topic. And once again, I am just so thrilled that they agreed to join us today, and really looking forward to your presentation. Stevenson and Becky, over to you.
Thank you so much, Mia, again, for inviting us. So without further ado, I'll just jump into my presentation. And so we are, at the very first part of our presentation, I'm going to talk about the project, and we will be sharing our findings for this project. And I understand that after this presentation, there will be some discussion, and I'm sure you've received, you know, the questions that that Becky and I have sent you. And so again, without further ado, let me just dive right in. All right. So this project is called Accommodating the Needs of Persons with Disabilities in Public Health Emergencies, Law, Ethics, and Practice. And let us just look at the news in Hong Kong in relation to persons with disabilities. As you can see, right, here we have a person who has mobility difficulties. Okay, so he cannot, he has difficulties moving around. He has difficulties caring for himself, so he cannot, go to the toilet by himself. He cannot, wash himself, etc. So I want you to imagine, his life. He is supported by the government. So the government provides what we call respite care. That means, a home-based service where people will cook for him, people will, take him for showers and take him to toilet, right? So without someone actually, helping him out, right? He can only sort of go to the toilet in his own wheelchair, right? So he's using some sort of diapers for adults. And so as you can imagine, right? When COVID-19 started, the government has to suspend all these services, right? So he's not receiving any care whatsoever. And so, so this, as you can understand, I'm sure you can understand Chinese here, right? So, he's having difficulties with hygiene and sanitation. Another thing, very important aspect has to do with carers of persons with disabilities. Yeah, so in Hong Kong, we have institutions for persons with intellectual disability. And during COVID-19, we know that, those institutions sort of shut down, all right? So the, persons with severe intellectual disabilities, they have to move back home, essentially. That created a lot of burden on the part of carers, usually the parents. And so here we have a tragedy. We have a carer, a mother of a person with intellectual disability actually couldn't bear the pressure, killing her son. And this is not just one episode where we're seeing quite a few of these cases. And here you can see, so in Hong Kong, we use an app for contact tracing. So what you do is you enter, a shopping mall, a restaurant, whatever. You have to use your smartphone to scan the QR code, basically. All right, that's how it works. Now, what happens is that persons who are blind, right, they cannot locate the QR code. All right, and and a lot of mobile phone, smartphone apps, right, are actually not accessible to them, right? They cannot actually use them. Now that also created a lot of problems. And here we have other persons with disabilities. So here we have a elderly senior adult who has suffered from a stroke, and then he has a son who has autistic disorder. And so I want you guys to just imagine, right, what kind of situation, the parent cannot use internet, they cannot purchase stuff online, and during COVID-19, of course, they cannot move about freely, they cannot actually go out to acquire goods. All the services from the civil society organizations, right, they suspended services. So I just want you to sort of imagine, the difficulties that they are having. And of course, COVID-19 also contributed to, unemployment. And of course, we're talking about persons with disabilities, so it's not like they do rely on employment to feed themselves daily, right? And of course, all the psychosocial sort of, psychological pressure, right, during COVID-19 as well. So these are, it gives you a very general idea of the situations of persons with disabilities in a public health emergency. And so that sort of gave rise to this project. The background of the project is that public health emergencies, as we know, have a great impact on the physical and mental well-being of persons with disabilities and their caregivers. Now, there is a lack of policy that address the needs in public health emergencies, which leads to the needs being neglected. Now, what we wanted to do is that we want to help the government plan for the future public health emergency. And why do we say that? Well, COVID-19 is actually not the first public health emergency, right? Especially in Hong Kong, as we know, we have SARS in 2003, right? Which is actually very, very similar, actually. And a lot of people say that, COVID-19 is not going to be the last public health emergency, as we know. And so what needs to be done, right, is to actually learn something from this. And so this is what we set out to do. Again, we want to help the government plan for future public health emergencies. And these are our research questions. So what is the experience of persons with disabilities during the pandemic? And what are the challenges that they are facing? What are the policies adopted in other countries and regions to address the rights and needs of persons with disabilities in public health emergencies? What does international human rights law require governments to do to protect persons with disabilities? And what are the ethical duties that governments must bear in a public health emergency? Now, we use the word public health emergency a lot. Right? So what do we mean by that, right? So according to Nelson and others, they say that, well, a situation becomes emergent, right? It becomes an emergency when its health consequences have the potential to overwhelm routine community capabilities to address them, owing to its scale, timing, or unpredictability, right? So, COVID-19 is exactly this kind of situation, right? So, in terms of the scale, in terms of, how unpredictable it is. And so again, right, our goal is to formulate an empirically based, so a part of our project is actually empirical. We went out to actually, interview persons with disabilities during COVID-19. And it's also theoretically informed. So we want to articulate a policy framework so that the government knows what to do in the next public health emergency, and it covers different stages of what we call emergency management, right? In terms of emergency mitigation, emergency preparedness, emergency response, and emergency recovery. So we're not just talking about response, right? It's not just as we will, talk about. Yeah. So when we're talking about emergency, it's not just about how you respond to emergency, right? It's also how we plan for it, right? So it's also how we become more prepared for emergencies. So these are the aspects that we are going to cover. So here we have, we pulled together an interdisciplinary team. So I myself, I'm a legal scholar, and we also have associate professor from Department of Social Work. So she focuses on social gerontology. We also have another professor who is actually a medical practitioner herself, and she is an expert in public health and rehabilitative medicine. We also have a lawyer and an advocate. Now he is an expert in what we call psychosocial disability, right? Psychosocial disability has to do with, for example, mental health issues. Yeah, so people with depression, for example, would be an example of a person with psychosocial disability. And we will look at why that is actually very important in the next few slides. And of course, we have Becky, who is an expert also in persons with psychosocial disabilities. So when it comes to research design, we have 3 different phases. The first phase is where we conducted focus group interviews with persons with disabilities across disability categories. Yeah, so we have one focus group for the blind community, we have one focus group for the deaf community, one focus group for persons with mild intellectual disability, and so on and so forth. Right? So we have focus group interviews with different disabilities groups. We also have a roundtable discussion to examine the different approaches in Asia. And also we have another roundtable discussion to discuss the broader questions of ethics and law. All right. There are some limitations to this project, and that is one very important limitation is that because we ended in January 2022, right? So we actually didn't cover what we call the 5th wave of COVID-19 outbreak in Hong Kong, which is the most serious outbreak. But nevertheless, our findings actually do apply to the 5th wave. And so let's look at the first part of our interview, and Becky will address us on that. Becky.
So for phase 1 of the study, as Stevenson has mentioned, it focuses on conducting focus group sessions with persons with disabilities in Hong Kong. So the objective of phase 1 is actually to understand and explore the experiences and challenges of persons with disabilities during COVID-19. And with the help of our civil service partners, we actually invited 74 individuals. 57 of them are persons with disabilities. So in the pie charts on this slide, you will see the breakdown of our participants, which includes 11 persons who are deaf or who has hearing impairment. 10 of them are blind or is living with visual impairment. 9 of them has a psychosocial disability. 11 of them has mild intellectual disability. 16 of them is living with bodily impairment or what we call physical or mobility disability. Our study also includes 7 caregivers who are usually the family members of persons with disability, and also 10 CSO is what we call a representative from civil service, civil society organizations, and also service providers, including social workers and sign language interpreters as well. So let's move on to the first major theme that we have found in our study. So first of all, contingency measures have had an adverse impact on the well-being of persons with disability. And in particular, we have found that persons with mobility difficulty and chronic illnesses, they face a drastic deterioration in physical well-being. So they are facing and experiencing great deterioration in their bodily condition. One of the major reasons is because of the suspension of rehabilitative services. So from the first quote in the box on top is by a senior adult who lives alone. So this participant, he shared with us that how he was being impacted by the suspension of service. So he said, if we don't have physiotherapy, our bodies deteriorate quickly. We cannot stand at all, and we fall down easily. It will be so much better when physiotherapy services resume. Our muscles will not be as stiff and we will stand much better. So this participant, he further shared with us that this has brought great challenges to his daily routine and life. So after the outbreak of the pandemic, he has not been able to cope with basic daily tasks, such as opening canned food or opening even a bottle of water. So this shows how the lack of regular and structured rehabilitation service during the pandemic strains the physical well-being of persons with disability. So the second quote that I put here on this slide, it's actually by a social worker of a community service organization. So she said, for some senior adults who have had strokes or who require continuous rehabilitation and recovery therapy, especially those with chronic obstructive pulmonary disease, it is very apparent that their condition deteriorates rapidly without exercises and training. Deterioration entails serious shortness of breath, or, for instance, having to start using a wheelchair. So in fact, it directly affects their prognosis and recovery progress. This can have many far-reaching implications: hospitalization, impacts on long-term well-being. I would say this is an enormous impact. So she actually highlighted some of the far-reaching impacts of the contingency measures and suspension of services. It also highlighted some of the specific groups among different types of disability, such as those with chronic obstructive pulmonary disease. They are particularly vulnerable in these circumstances. So the second major theme that we observe from our analysis actually relates to well-being, but more on psychological well-being this time. So the pandemic has had an adverse impact on the psychological well-being of many, and this is exacerbated by self-isolation and the closure of community center and lack of peer support. So not only has the pandemic brought huge setback to the physical well-being of persons with disability, but it has also brought adverse impact to especially those who have existing psychosocial disability. So from our analysis, we noticed that participants, especially those who with psychosocial disability and carers of persons with disability, they experience self-isolation during the pandemic. One of our participants who has a bodily impairment as well as a psychosocial disability, she was very conscious about her heightened vulnerability during the pandemic and her heightened risk of infection. And that is why she chose to stay at home for 7 months without going out at all. Until she actually experienced an emergent medical conditions where she has to be sent to the hospital immediately. So this is actually quite worrying. And from the two quotes that I selected here, the quote that I selected here, the first one is actually from a blind caregiver, where she mentioned about as a aging carer, she mentioned that herself is actually getting older and she actually has to take care of another person. Sometimes when we even when we feel ill, we don't dare to go to the hospital because they are being worried that they will be hospitalized and they won't be able to care for the members that they have been caring for. And so they know that some carers, they actually refuse to be hospitalized even when the doctors advise them to do so. So the second quote I selected here is from a female participant with psychosocial disability. So she mentioned that she could go to the center, the community center, and communicate with others in a similar situation before the pandemic. We could be together instead of being stuck at home. I feel happy when I can talk to my peers. So the pandemic has impacted my life enormously. It affects my mental and emotional health because it has lasted for more than a year now. It is not just a few months. It has really affected my mood. I'm unable to express my negative emotions, and I feel like I have bottled up many emotions while I have been at home. So from these two, but one a carer and another a person with psychosocial disability, we have noticed that the suspension of support services has directly affected the psychological well-being of carers. They face loneliness, they feel anxious, and especially they are living in a constantly anxious and stressed condition. So this is the second theme that we identify. The third theme we identify is about accessibility. So in disability, we talk about whether information provided to persons with the disability are actually made accessible for them. For instance, whether what Stevenson has mentioned about locating and scanning the QR code. It works for people with healthy and normal eyesight, but it actually doesn't work with people who are blind. So whether these different information has been made accessible to these persons with disability is actually important during a pandemic, especially when it involves information that are health related. It involves vaccination information and contingency measures. So in our findings, we discovered that official information was not disseminated in accessible formats. So for instance, in videos that teaches blind persons how to wash their hands or how to wear a mask, it actually lacked audio description or alternative text for blind person or visually impaired person. So they are not able to access these information. This female participant who are blind actually provided us with a more concrete and specific example. So she mentioned that she has browsed some videos uploaded to the internet by the government, and there is background music without anyone talking in the video at all. So it teaches you how to wear a surgical mask. It has subtitles and animation. It lasts for around 20 seconds, but there is no narration at all. So all the blind person know, all they can hear is some background music. So they don't actually know what's happening in the video. And she continues by sharing, because people with normal vision, you can see how to extend the mask to cover the nose, your mouth, and chin. You know that is the proper way to wear it. But for those of us who have also worked as volunteers for some hotline, we discovered that individuals with visual impairments are very likely to wear masks incorrectly. They don't actually they are not able to differentiate, which is the front and which is the back of the mask. They are not able to follow completely with personal hygienic or protective measures. And also for testing kits that are distributed to citizens or even persons with disabilities. It doesn't include instructions in Braille format. So, they don't actually know how to conduct a rapid test. They don't know how to scratch their nose with the testing kit. So it's difficult for them to keep track on their own body condition as well. And this has affected the blind community greatly. And not only has accessibility issues affect persons in the blind community, it also affects persons with intellectual disability as well. So that leads us to the fourth theme and observation in the study. So health-related information, such as that relating to the available types of vaccinations, the side effects, and potential health risks, they lack easy read version. So easy read version actually entails simple sentence structure and coupled with supplementary illustration and pictures or photos. For instance, a simple example would be if there is an easy read a COVID prevention guide published by a self-help organization in Hong Kong in many different languages. So it actually has very simple sentences and also illustration to teach, for instance, persons with disability how to wash their hands, so that everyone can understand the message very clearly in a very simple message and precise message. So this person with intellectual disability, he mentioned that he hopes the government to be the one who translates and provides easy read information. I hope Easy Read does not only cater to persons with intellectual disability, but to anyone who does not wish to rely on text. So he mentioned that the government will be in a much better position to prepare these information because usually, for instance, vaccination information or contingency measures information, unavoidably, it involves medical jargons, technical terms, which persons with intellectual disabilities or those who are not in the medical field might not be very familiar with. So by shouldering the responsibility in providing these easy read information, it would be so much easier for persons with intellectual disabilities to understand the information and take relevant measures to protect themselves. And not only would this benefit those with intellectual disability, like what our participant has mentioned, it actually benefits everyone who does not wish to rely on text, including, for instance, senior citizens. You know, they might not be using our smartphones to, access different social media to read news or updated information. These easy read information would actually help them to keep track on the development of the pandemic as well. The fifth and the final major findings in phase 1 relates to the ability to exercise their legal capacity. So during the pandemic, there was a shortage of sign language interpreters because not many sign language interpreters were willing to deliver services in high-risk settings such as hospitals and clinics. So that has left persons with hearing disability more vulnerable in these situations. So especially healthcare workers, they often wear masks without clear windows. So there were people with disability, they are not able to read the lips of the healthcare workers or also frontline health workers. So this male participant shared that he has to rely on his family members or friends to accompany him to medical appointment. But he is quite against this idea, or he's quite reluctant to attend these medical appointments with his family members for the following reason. So he thinks that family member is not suitable. That is, they will be hastier than me. They will help me to decide on everything. But I think medical appointments are between me and the doctor. And my family should not replace me or substitute me in making decisions. And when my family is present, the conversation or exchange will only be between my family and the doctor. And I will know nothing about what is or what will be happening to his own body. And later, my family will simply ask me to take medicine. That is the only thing I know. But I own my body and I really wish to understand what is happening to my body. But my family will only relay a very brief summary, even though I know the doctor has said a lot more than that. So it is very difficult for persons with disabilities to receive medical information and to make informed medical decisions and give medical instructions in these circumstances. And this has seriously affected the right to exercise their own legal capacities and in making their own medical decisions as well. So to summarize, there are 4 major findings and challenges persons with disabilities in Hong Kong face during the pandemic, including the first one, the deterioration of their bodily condition as a result of the suspension of medical, rehabilitative, and home care services. Second, the pandemic has brought enormous changes in persons' lives, as many community services and peer support groups are suspended. And this has a great adverse impact on the psychological well-being of persons with disabilities and their carers. Third, information such as those relating to preventive measures, emergency contingencies, and vaccines are inaccessible to persons with disabilities and are disseminated in a manner that many of them may not be able to understand. Finally, the increased difficulties with communication owing to the lack of translation services with medical practitioners and frontline health workers affects their self-determination as well. So I'll pass the time to Stevenson to explain to you about our findings in phase 2 and phase 3.
Thank you, Becky. Well, I'm just going to go rather quickly for phase 2 and phase 3. And so for, again, right, phase 2 is about a comparative study of different Asian countries and regions. So in phase 2, basically what we looked at, we have invited experts from mainland China, Taiwan, Thailand, Singapore, South Korea, and Japan to share with us our, what they experienced in those jurisdictions. Now, our main finding is that, regrettably, prior to the pandemic, none of these jurisdictions compared have expressed legal and policy provisions to protect and address the needs and rights of persons with disabilities in their emergency laws. Now, that is a huge disappointment for us, right? Because if you can imagine, right, in all these jurisdictions, right, there will be floods, there will be earthquake, there will be typhoons, right? So, how are they going to evacuate, for example, right? Persons with mobility difficulties, how are they going to evacuate people who are blind, right? At least there should be some sort of guidance, but we cannot find any. Now, so what we did find, however, is that, well, in jurisdictions that have a robust support system for persons with disabilities in non-emergencies, right, these jurisdictions are better able to address the needs during the pandemic. And so what are these measures, right, that help them cope better? The first is in relation to laws and policy. So in many of these jurisdictions compared, they have express laws that provides for information accessibility, welfare, healthcare, assistive technology, and equipment, right? So basically, these laws help these jurisdictions ensure that, for example, assistive technology, right, or healthcare, et cetera, right, will be available during an emergency as well. So let's just look at one example. So in this example, the Communications and Broadcasting Authorities in Thailand actually imposes a tax on telecommunications companies that is dedicating, and they dedicate that tax, right, for developing accessible technology and providing accessible services. And so basically what they did with all this money is that they developed what we call a relay service that allows deaf persons to acquire instant sign language interpretation over their smart devices, right? And that helped them during the emergency as well, right? Because, persons who are deaf, right, they cannot, leave their houses, right? And sometimes they cannot acquire sign language interpreters, right? Because sign language interpreters refuse to go to the hospital for them. So it's actually very important that we have these kind of technologies. And again, right, this is available in normalcy, and therefore it was available in the emergency as well. Another thing that made them stand out is in relation to data collection. So for example, we found that in jurisdictions that collects data specifically relating to persons with disabilities, those data help the government to understand the geographical distribution of persons with disabilities, which then assists them with resource allocation. And other type of data that we find that some governments are actually doing is that they are collecting disability disaggregated data. All right. So for example, in relation to the number of vaccines and vaccinations based on different disability categories, right? And these data help them understand how different vaccinations, right, have different side effects on different disability categories. And that was important as well. comprehensive data also enables some governments to provide personalized care, right? So for example, in one example in Taiwan is that, they collect a lot of data in relation to persons with disabilities, so that during the COVID-19 pandemic, right, they can actually mail a lot of instructions in Braille, right? Braille basically means the language that, what do you call that? In Braille,
凸字凸出来的那些点字
right?
点字
For persons who are blind, right? They can actually mail these materials directly to them. And so that's why it's actually very important that we have data, that we have information, especially in a pandemic. The third important aspect of different jurisdictions performing better is that some jurisdictions have different committees within their governments that enable the participation of persons with disabilities in policy making. And so, for example, in Thailand, in 2007, they established a national committee on the empowerment of persons with disabilities. Now, this committee comprises parliamentary members, senior government officials, and also persons with disabilities, and is actually chaired by the Prime Minister. And so this committee, right, they deliberate on policies that actually affect persons with disabilities. Now, during the pandemic, we know that governments are completely overwhelmed. All right, the governments are overwhelmed with, caring about the economy, caring about education, caring about, all kind of stuff, right? Of course, the emergency contingencies as well, right? And so, the needs of persons with disabilities will be ignored, right? They will be ignored unless there is a formalized sort of institution, right, that actually take care of their needs. And that's what happens in Thailand and also in Taiwan as well. There was a committee within their executive branch that expressly includes persons with disabilities, right? And these are the occasions where they can actually voice out their needs during the pandemic. Another interesting aspect that some governments adopt is the disability offices. So for example, in Thailand and Singapore, they actually have, a specific office, right, that has specific mandate that targets persons with disabilities, right? They provide all sorts of services to them. They, for example, they take care of a lot of, community services. They provide respite care. Respite care again means home-based services. And so this office, right, is specifically dedicated to persons with disabilities. And many often, these offices themselves employ persons with disabilities as members of staff, and they're in close connections with different civil society organizations. And so during the pandemic, again, right, because the specific mandate, right, is persons with disabilities, so it's very natural for them that the first thing that comes to their mind during the pandemic is how the pandemic actually affects persons with disabilities, right? And so with these disability offices, we found that these different jurisdictions actually perform better when it comes to addressing the needs. So let's very quickly again, right, move on to phase 3. Phase 3 is about discussions on public law and ethics. So we invited 5 experts from the United States, Canada, and Hong Kong, and we discussed 2 issues. The first question is, what are the moral issue or moral crises that may arise during a public health emergency, and in what ways they affect persons with disabilities? That's the first question that we asked. The second question that we asked is, what constitutes an inclusive emergency management, and what are the implications from international law and international good practices in this regard? And so this is our finding. In relation to the first question, we found that there are lots of stereotypes and discrimination against persons with disabilities. These are such as medical biases that exist, right? And some people actually mistakenly believe that persons with disability have a lower quality of life and lower chance of recovery. So that when it comes to resource allocation, when resources are actually not available to everyone, right? They think that persons without disabilities should be prioritized. Now, this is misbelief. Is a mistaken belief, and it's a mistaken belief because, well, a person's life expectancy, for example, right, have much more to do with the person's habits, for example, right? So a person with disability who doesn't really smoke compared with a person without disability who smokes and drinks alcohol, right? And so it's a stereotype, really. It's a mistaken belief, right? Now, of course, these stereotypes against persons with disabilities undermine the equal access to medical treatment and resources. These stereotypes further led others to believe that persons with disabilities are competing with them for limited resources. Now, that intensifies discrimination and sometimes leading to hatred against them. In some parts of the world, stereotypes led others to believe that persons with disabilities are less able to protect themselves and thus more susceptible to infection. And in some parts of the world, they actually deny services, deny providing services to persons with disabilities because of that. Another ethical issue has to do with the lack of trust. Now, there are two aspects. First is the lack of trust among communities, and the second is the lack of trust in the government. Now, because of the stereotypes and the discrimination that we just talked about, right? Now, that led people to become very self-centered. In some parts of the world, people firmly believe that, for example, wearing a mask is a matter of personal choice. They ignore the fact that the refusal to wear a mask may pose risk to others, especially those who are immunocompromised and those whose medical conditions prevent them from wearing masks, right? There are persons with disabilities who cannot wear masks, right? Because, it really affects the breathing too much, right? There's also a lack of trust heightened by a sense of self-preservation and protection in emergency. And a general alienation during the pandemic, right, led to a lack of empathy and a lack of the sense of mutual aid in the community. And that has enormous impact on persons with disabilities, right? Because sometimes, all they actually rely on the community, right? Their neighbors, their friends to help, right? Now, because of the heightened sense of self-preservation, right? They actually get much lesser help from their neighbors, from their communities. Now, there's also a lack of trust in governments in parts of the world, which led people to believe in this misinformation. Now, of course, that misinformation could be about the pandemic itself, and it could be about persons with disabilities as well. In this part of the world, the lack of trust in government made the implementation of certain policies, such as that in relation to mask mandates and vaccination, very difficult. So what are the factors that would contribute what we call an inclusive emergency management? The first factor that is very important is accessibility, right? So accessibility in relation to information, right? So all information must be provided in a format that they can actually read or understand, right? That's very important, right? Otherwise, they'll be, they cannot actually receive any information about the pandemic. They cannot receive any information about the government contingency measures that's being imposed. So accessibility in terms of that information, accessibility in terms of medical services, accessibility in terms of other community services and support services, right? That is being suspended during the emergency, right? Is actually very important. So we need to make sure, for example, that some of these very essential services are not being suspended, right? That's all part of accessibility. Second, participation, right? Now, participation basically means that the person with disabilities can actually participate in making the policy that actually affects them. And that's very important because sometimes, right, we simply don't understand the challenges that they face, right? And they themselves know much better than us what they actually need. And so participation is actually a very, very important aspect. Non-discrimination, right? So there is a need to eliminate stereotypes. There is a need to make sure that all of the policies that the government introduce do not disproportionately affect them. All right, now that's all part of non-discrimination. inclusive policymaking and data collection, right? So we need to collect data that is disability specific, right? Otherwise, right, the data that the policymakers that rely on, right, to make policies cannot reflect the needs of persons with disabilities, right? And that's one of the very important factors in an inclusive emergency management. Inclusive response. So emergency responses needs to be inclusive as well. Now, let me give you one example. So in one of the studies that we come across, we actually have a situation where frontline healthcare workers are trying to remove persons with intellectual disabilities from the residence to the current quarantine venue, all right? Now, because they don't understand them, they don't understand their needs, they don't have training in relation to how to deal with persons with severe intellectual disabilities. So you can imagine what happened, right? Of course, persons with intellectual disabilities, they yell, right? So they have severe intellectual disability. They get completely panicked. They struggle a lot, right? So what happened is that these frontline healthcare workers strap them down on a stretcher, all right, to forcibly remove them from the residence to the quarantine venue. And they remain strapped down in the quarantine venue as well, because frontline care healthcare workers, they don't know how this person with disability is going to react. He walk around and stuff. That's what they fear, right? So the lack of sensitivity, the lack of understanding of the needs of persons with disabilities, right, actually affects whether or not emergency response is inclusive enough. And cooperation and coordination is very important. There needs to be cooperation between the government and civil society organizations. And there needs to be cooperation, not just with frontline healthcare workers, of course, we need cooperation within the spectrum of government departments, for example, in the welfare departments, in education, et cetera, right? So what we need to do is that we need to gather all these government policymakers, right, together with persons with disabilities, together with civil society organizations, to sit together so that they mutually understand their limitations, right? So sometimes persons with disabilities, they have expectations that cannot be realized, right? That is not very practical, right? So it's actually very important that they know the limitations of the government as well, right? And so this kind of mutual discussion, this mutual communication is actually very difficult. And this is what we mean by cooperation and coordination. Creating conditions for inclusiveness is very, very important. That means that, even before a pandemic, we need to create conditions so that we can be inclusive, right? So we cannot simply, talk about accessibility during a pandemic. We know that during a pandemic, everything is chaotic. The government is completely overwhelmed, right? So we cannot start talking about, for example, accessibility or inclusiveness during a pandemic, right? We need a lot of preparations. The discussion, the preparation needs to start before a pandemic. And that's what we mean by creating conditions for inclusiveness. And that's very important. So what are our overall findings? What is our overall policy framework? Well, our overall policy framework is based on three normative duties that we think the government must bear during the public health emergency. The first duty is what we call the duty to protect. So this duty to protect means the duty on the part of the government to protect the rights and well-being of citizens. And that includes persons with disabilities, right? So that includes, for example, protecting persons with disabilities from physical and mental harm. Second, to prevent persons with disabilities from being exposed to unnecessary health risk by means of reducing their vulnerability during public health emergencies. So what increases their vulnerability? For example, right, we find that during the pandemic, a lot of people lose their jobs, right? And that includes persons with disabilities. For example, blind people, right? What they do is they do massage therapy, all right? Now, of course, during the pandemic, that they lose their job, right? That there's no business whatsoever for them. What happened is that they cannot afford to buy masks. They cannot afford to buy, disinfectants, et cetera, all right? So in order to reduce their vulnerability, right, what the government should do is to, give some sort of financial relief, right, so that they are not rendered more vulnerable in a public health emergency. So this is what we mean by vulnerability. That's one aspect of it. Third is to protect the rights of persons with disabilities, ensuring that their rights are respected even in an emergency. And that includes, for example, the example that Becky just mentioned, right? One very important right is that they have a right to legal capacity. They have a right to make their own medical decisions, right? And even in a public health emergency, this right should be respected. So this is what we mean by the duty to protect. The second duty is the duty to plan, right? Again, if we do not plan in advance of an emergency, there's no way in which we can achieve inclusiveness, all right? So there is a moral duty to plan ahead of an emergency, and this includes two very important aspects. The first aspect is to mitigate the health risks of persons with disabilities in future public health emergency. Now, for example, in Hong Kong, we have very crowded care homes for the elderly and for persons with severe intellectual disability. And guess what? During the fifth wave, right? The virus started spreading like wildfire in these institutionalized settings, right? And can we actually mitigate that, right, during an emergency, right? Can we say that? Can we simply send them home, right? Of course not, right? So in order to sort of reduce that crowdedness, right, there needs to be some long-term planning, and that long-term planning needs to take place before an emergency, right? So this is why we think that, well, this is a duty to plan, right? And it involves mitigating the health risk. Second is to strengthen the capacity of the government and private actors to respond to potential public health hazards and crises. Now that, of course, includes, for example, public education, right? So that, citizens know how to protect themselves during a public health emergency. And that, of course, education for persons with disabilities, right? So that persons with disabilities know how to protect themselves. And, some of that, education material would be a bit slightly different from the material that you give to the general public, right? Simply because they have unique situations. And other aspect of that is, of course, that the government officials need to be sensitized in relation to their needs, right? So they need to know, for example, the communication needs, the medical needs, the support needs, right? So that they know how to deal with persons with disabilities in the front line, right, during a public health emergency. So this is what we mean the duty to plan. The third duty is what we call the duty to lead, right? So during a public health emergency, in fact, during any emergency, right, we expect the government to play a leading role, of course, right? Now that leading role, right, means to provide guidance and moral leadership in relation to public, in a public health emergency. We want the government to lead us out of that situation, right, to lead us out of the crisis. Now, part of that, being a leader, right, implies that you can communicate, right? And if the policies that you introduce is not something that the person with disabilities can comply with, right, now that's something, that you're failing your duty to lead, right? That's what we mean. So for example, during the fifth wave, and I think Becky talked about this, right? The government in Hong Kong, right, gave us these, rapid testing kits so that we can take, right? Now, again, right, for blind people, they can't do anything with them, right? Because there's no instruction in Braille, for example, right? And so, this is a failure to lead. You're communicating in a way, or you're imposing a policy in a way that they cannot follow. People cannot follow you. All right? Of course, another aspect is to promote transparency and accountability, right? That's always important. And that helps with promoting trust, right? Because without trust in the government, right, there's no way in which the government can pull everyone together. And pulling everyone together, right, is actually very important when it comes to taking care of persons with disabilities, right? Because, when everyone cares about themselves, right, who's going to suffer most? Of course, persons with disabilities. And of course, strengthening government civil society collaboration is very, very important. Now, these three duties, right? They interact with each other, right? So without the duty to plan in advance, there's no way that the government can protect, right? So, and of course, the duty to lead, right, implies the duty to plan in advance, right? So there's some sort of interaction between these three normative duties. So now that gives rise to our specific recommendations. I'm not going to go through them one by one, but we did make 22 recommendations to the government, and we sort of, fit them all together in light of the three duties. Yeah. So I'm just going to go through with you some of them, just to get, so that you can have a sense of how to sort of make sense of this table here, right? So on the left part, you see the normative duty. So the duty to protect, for example. And then, the aspect of this duty, right, to protect the rights of persons with disabilities. And these are our recommendations, right? For example, to ensure accessibility of information and services, to ensure that they have access to their supporters, and, et cetera, right? So how to ensure accessibility of information, right? And that is to, provide accessible formats, right? Provide stable supply of medical resources adapted to the needs. Let me give you another example. Yeah, when you have a fever, all right, you use a thermometer at home, right? And that thermometer, of course, gives you a reading of your body temperature, right? Now imagine if you're blind, right? Can you actually use that thermometer, right? The thermometer can, it gives you a reading, but it doesn't really speak, right? So, this is what we mean by medical resources needs to be, adapted to the needs of persons with disabilities, right? It's really, as simple as that. Providing training in medical sign language, ensuring sign language interpreters are adequately trained. So these are the methods. Yeah. So from the normative duty to the specific obligations, and then the recommendations on how that sort of relates to the specific obligation, and then the methods of how to sort of fulfill the duties, right? So the same with the duty to plan as well, right? So the duty to plan implies, again, right, mitigating the health risk, right? It means to devise emergency mitigation preparedness and response plan. Deinstitutionalization, right? That means to think about, right, whether or not we actually need care homes for elderly, for example, or for persons with intellectual disability, right? So there are, things like aging in place, right? That corresponds to the deinstitutionalization. There is something called community living. That means, providing a lot of community support so that they can actually, stay at home. They don't have to go to care home, right? Now that helps decrease the overcrowdedness in care homes, and that's part of duty of the plan, right? So again, I'm not going to go through each and one of the recommendations. This is our dissemination website. If you are interested to know more about our work, you can visit this website. And in this website, I'm not sure if I'm sharing. Are you guys looking at my screen? All right. So on this website, you can find the different versions of the report. And then you can also find the easy read format. So this is for persons with intellectual disability. So this is what we mean by easy read. So it's a very simplified version of the report supported by images, right? So it's very, very simple, right? And it's mainly for persons with intellectual disabilities, but it's also for, people who are not used to reading a lot of words, essentially, right? There's also an audio version, and there's also a sign language version, right? So I guess that's all for our presentation. Sorry, it has been a very long presentation, but I hope you guys enjoyed it. And so,
thank you so much.